We want to turn to another critically important issue, and that is the massive impact of cuts to Medicaid and other healthcare programs in the United States that are set to begin here with the upcoming the completion of the upcoming budgetary talks in Congress. And we are very, very honored to be joined here on the show by Michael Furlow, who is a licensed practical nurse in New Haven, Connecticut, and part of SEIU 1199 Northeast. Michael, thank you so much for being with us.
Thank you. Great to be here.
Well, it's great to have you here to help us sort through all of this. And you've been working in nursing homes for over 20 years, including at the height of the COVID-19 pandemic, by the way. And I was hoping you could just describe for us the general conditions, for in nursing homes and the issues of underfunding and how that's really shaping life for you, the workers, and of course, the residents as well.
Well, I can tell you the conditions in nursing homes, they're not great. We are lacking supplies. There is a serious issue with residents not having the daily supplies that they need for their activities of daily living. I mean, something just as simple as slippers. We have residents walking around in socks. They have no shoes. During the pandemic, we risked our lives to come in and take care of residents who were positive with the COVID virus. We were told that we're essential. You come in, you take care of these residents, we will take care of you. This is what we were told. And we did that. We came to work. We risked our lives and the lives of the loved ones who lived with us, because at that time, nobody really knew what the virus was going to do. And jump 5 years later, and we're still dealing with underfunding. We're still dealing with a lack of important supplies. You know, um, in my opinion, I don't see that things have gotten any better. In my opinion, we are still in a form of a pandemic.
Wow.
Yeah, I mean, it's really stunning when you think about how little has changed in that sense. And you and other nurses are buying things out of your own pockets for residents, things like soap and food. And then at the same time, you have the federal government moving to slash Medicaid and Medicare, which are, of course, these lifelines for so many elderly and disabled people across the country. So I'm curious if you can talk a bit about what these cuts will mean for your facility and for the people that you care for every single day.
These cuts would be devastating to really to any nursing facility. They would be devastating. The majority of the residents who I care for are either on Medicaid or on Medicare. I know a lot of facilities do rely on this funding in order to care for the residents. So you have to think like this. These nursing homes are these residents' homes. This is where they live. And a lot of with these slashes, with these cuts, there are going to be residents with nowhere to live, with nowhere to go. Because if Medicare stops paying for their bed at the nursing home, I'm not confident that these nursing home owners are going to opt on the side of losing money. I've seen residents put out in the past. I can't say, for financial reasons necessarily, but I do know how nursing homes operate. And if you can't pay to be there, if the state stops your funding, they don't just keep you there.
I mean, it's an amazing issue. I mean, because this is like, we're talking about nursing homes, right? And this is like our senior citizens, our parents, our grandparents. Like, this is one area where I think everyone feels like you want to have the best possible everything. But it seems like what you're saying is that there's almost like an apartheid style system. Like, if you can pay, you're going to be in a great facility. But for anybody who isn't privileged enough to have a lot of money and a great retirement plan, that already it seems like we're seeing a lot of nursing homes close, that this crisis could just get worse.
Yes, I mean, I think in the future, this is where we're headed. We're headed for more nursing homes closing. We're headed for a more of a situation where nursing home owners are treating these nursing homes as a vehicle to make millions of dollars. I mean, let's just be honest here. They're making millions of dollars and they're treating the nursing homes as a way to just increase their profits. You know, healthcare is serious business. If you get into healthcare, you get into it because you're trying to take care of people, not trying to make as much money as you can. So the lack of funding, what I can tell you, what I see in the nursing home that I work in, I mean, we don't have soap.
Mm.
And so just imagine a nursing home where we can't find soap. Last night, the supervisor was able to find 2 bottles of soap, and that had to last my shift, which is the evening shift. It had to last for the night shift. These are the types of situations that we're coming into. Another thing which is very minor, but it's a big deal, is trash bags.
Mm.
You got to have trash bags in a nursing home. The kind of stuff that goes into a trash bag at a nursing home, believe me, it's serious. So when we don't have a simple thing as trash bags and we're trying to properly dispose of medical waste, that makes the job more challenging. It puts a strain on infection control, which is what our main goal is to limit the amount of exposure, for other residents. So we very rarely do we have enough trash bags. We're always looking for trash bags. The trash bags that we do have, you could blow into it and it will blow a hole right through it. That's how thin
Mm.
they are. So I mean, I can go on and on and on. Last night I had no tape to do dressings. So when I'm trying to change someone's bandage, you need tape. That's pretty important. Last night the nurse who works across the hall from me had no tape. We were looking, I mean, I can't tell you how much time we spent looking for tape. And we were able to find a type of waterproof tape that really isn't appropriate for dressings. So, I mean, long story short, this is no way for healthcare workers to have to try to do their job by searching for supplies through the majority of the shift, or what's going on, like was said before, is healthcare workers that I work with are buying soap from Walmart.
Mm.
They're buying the supplies that they need so that when they come to work, they can take care of a resident with the dignity and the respect that they deserve.
Mhm.
And I mean, these are some serious, serious challenges that you're describing. And I'm just curious, despite all of this, you and your coworkers are still organizing, still speaking out. So, can you talk a bit about what keeps you going and how are nursing home workers fighting back to protect both their rights as workers and the dignity of the residents they care for?
Well, with the 1199, with the unions, our strongest card is to strike. Our unity, our strength in numbers, our ability to stand together shoulder to shoulder. That's something that's very powerful. That's something that we were able to, the threat of a strike, we were able to implement against the state of Connecticut. And we went from them saying, we'll give you $0 to them giving a significant amount of money. So the ability to strike is something that we don't use that ability lightly. Okay, so when we say that we're going to go on strike, that's not something that we want to do. That's not something that we take lightly. It's serious consequences for striking. But I think that what happens is you get so frustrated at the lack of supplies, at I haven't gotten a raise in, I don't know, it's been about 6 years now.
Mm.
So as a nurse, a nurse doesn't deserve to get a raise. So there are a lot of issues that we are able to deal with through 1199, through the ability to organize and through the ability to strike. But I have to tell you, a lot of the nurses and CNAs who I work with, we're passionate about taking care of the residents. You know, that means more to us than anything is making sure that the residents are properly cared for. This is what we come to work for. This is why we came during the pandemic. This is why we get up and we come into work. We buy supplies that the facility is not supplying, you know, because we care about these people.
Well, Michael, you are showing why the Reverend Dr. Martin Luther King said that 1199 was his favorite union. And we really appreciate you being willing to join us here on the Freedom Side and help just explain what's really going on inside the nursing home sector.
Thank you for having me.